If you form calcium oxalate kidney stones, it's possible that you may be suffering from something called low diuresis. In this video, we'll outline what low diuresis is and what you can do to help reduce your risk for kidney stones. Hi, I'm Joey Weichman, and welcome to Stone Relief. In today's video, we're going to talk about something called low diuresis and how it relates to your risk for kidney stones. Now, without making this too complicated, low diuresis, just really at a baseline, is low urine volume. And this can be caused by a number of different factors, but at the end of the day, low urine volume, really, we are looking for urine volume that is less than 2 liters, which is roughly about 64 ounces of urine passed. This is what defines this. And when you have low urine volume, a number of negative things kind of cascade down that increase your risk for kidney stones. One of which is that when you've got low urine volume, your urine concentration is just going to be higher in general, and that means that there are more potential stone-forming particles sitting in your kidney, in your urinary tract, for longer than they need to, giving them more time to potentially bind together to form kidney stones. And that time for binding is a really big piece of it, because again, if we're not passing much urine, we're giving all those stone-forming elements all the time that they need to be able to get together to form, in particular, calcium oxalate, but also calcium phosphate stones, given the appropriate urine pH.
Just a reminder, this information is available in written form on our website. Find the link below in the description.
Now that we've laid the foundation for what low diuresis is, let's investigate some of the things that might be contributing to that low urine volume for you. So the first one is probably the most commonsensical one, which is just low water intake. If you don't drink a lot of water, you're not going to pass a lot of water, and that will then lead itself to a low diuresis situation where increased concentration of particles in your urine and an increased risk for kidney stones. So low water intake obviously will thus net you low urine output. Prostate issues are another big one. So if you have a situation with your prostate, maybe your prostate's enlarged and you're not passing urine as frequently or at the same velocity as you would have normally or in the past, this is also a situation where you're going to be impacted by low diuresis, because again, urine is not flowing through your system as it would have normally or as quickly as it would have normally, which is then leading to higher concentration levels of particles, just like it would if you're not drinking enough water. So understanding issues with your prostate could also potentially be leading to this situation. Chronic kidney disease. This is something that not a lot of people associate with this, but your kidneys process waste products from your blood, which then gets turned into urine and then gets excreted out of your body. And if you have chronic kidney disease, your glomerular filtration rate, or GFR, is likely impacted and is lower than it should be, which means you're processing less blood, processing less waste, and thus passing less urine. So chronic kidney disease could also be contributing to low urine volume. Next, heart and lung conditions. Again, the heart pumps blood around everywhere and is a major player in the amount of blood that your kidneys are going to process as well. So issues with these two things are going to play a role in the amount of blood that's moved around your body, and thus the amount of blood that is processed by your kidneys and the amount of urine that you're going to pass. Lastly, there are some medications that have the ability to monkey with this as well. So NSAIDs in particular, they reduce blood flow to the kidneys. That is the mechanism by which they are offering pain relief. So NSAIDs are going to be potentially a source if you're taking this on a regular basis. Antibiotics can screw around with your urine level or the volume of urine that you pass. Chemotherapy drugs, and then also immunosuppressants as well, will play a role in the amount of urine that you're passing on a daily basis. Lastly, real quick, just wanted to touch on a few things that you can do to help positively impact your low diuresis, provided it's something that you can manage. So for most people, as we were going through that list of contributing factors, I would say probably safely 80% of the people who are suffering from kidney stones and it's a result of low diuresis, water is going to fix most of that. So drinking more water is a great place to start. It's easy, doesn't cost you much, And the American Urological Association recommends minimally 3 liters, which is roughly about 96 ounces of water on a daily basis in order to achieve adequate hydration that's going to allow you to pass the amount of urine that you need to pass in order to make sure that urine concentration doesn't get too high, and again, that you're not providing too much time for those stone-forming elements to be able to bind together and form kidney stones. So 3 liters is a great place to start. Next, if you have any underlying medical conditions, let's say that maybe you have an enlarged prostate issue. Maybe there's a natural alternative that you could use, like saw palmetto, to be able to help reduce that inflammation, the enlargement of the prostate. Maybe there's a chronic kidney issue that's at play there. There are a number of things, but if you can address the underlying cause of what's kind of impacting your low urine volume, because there's another issue, this will also be a very, very effective lever that you can pull on to help improve your situation. And then lastly, if you're using a lot of over-the-counter or prescription types of medications, many of those are going to have an impact on low urine volume. You'll see that indicated on the side effects typically, but especially NSAIDs are just so prevalent in use, and they dramatically decrease blood flow to the kidneys and thus urine flow out of your body. This is also going to be a really, really big area where if you cut these things out, you're going to recognize a dramatic increase in the amount of urine that you're going to pass on a day-to-day basis. If you'd like to join a community of men seeking to avoid surgery and prevent their kidney stones naturally, visit our website. See you in the next video.